Good afternoon, everyone. Myself, Dr. Vishal Prakash Nandeshwar, presenting the topic thermal burn of ocular surface due to accidental vapor explosion in iron slag yard of steel plant. Introduction: accidental burn due to failure in safety or malfunction of process is very devastating. It results in loss of vision and great impact on the socio-economy of workers and employer. Ocular burn due to steam vapor explosion in hot iron metal slag due to water entrapment is rare and alarming. The iron slag yard in steel plant consists of 3 phases: skimming, cooling and loading. Each phase sequentially progress for 8 hours. In skimming process, slag is poured in yard with no excess water, resulting in fewer explosion risks. Then an unstable and dangerous procedure, workers operated nozzles manually for the first water injection cooling. A significant point to be noted is that workers poured water by using the bar type water injection, allowing cooling water to flow directly into the high temperature molten slag that ultimately caused vapor explosion to occur due to expansion of fluid volume. Case description: my patient was 24-year-old Hindu male contractual worker. He got burned due to steam vapor explosion at iron slag during cooling process. No protective device was used. This is the external photo of the photo showing facial and ocular burn. We can see that periocular scald burn, corneal burn in bilateral eye due to vapor explosion in iron slag. Ocular findings in right eye: visual acuity was counting finger at 2 meter. Periocular skin scald burn present. 3/4 of the corneal burn with a 270-degree limbal ischemia. In left eye, visual acuity was 6/60. Periocular skin and scald burn. Inferotemporal corneal burn with a no limbal ischemia. On fluorescein staining of cornea showing epithelial defect, in right eye there was large epithelial defect, and in left eye relatively small epithelial defect was present. On investigation, routine blood investigations were within normal limits. On X-ray and CT scan of both orbit reveals no foreign body and no fracture of bone. On treatment part, medical management, we give antibiotics, steroid drops, lubricants, cycloplegics and vitamin C tablets. In surgical part, amniotic membrane graft, tenons patch graft and tarsorrhapy was done. This is post-op photo of the patient. Amniotic membrane graft with tarsorrhapy and tenons patch graft was done in right eye, and in left eye tenons patch graft was done. After healing, we can see in right eye and in both eyes the cornea was clear, epithelial defect get healed, and anterior chamber was quiet. My conclusion was that corneal and limbal involvement prognosticate the outcome. Early amniotic membrane graft and tenons patch graft helps for early visual recovery. To ensure use of protective safety device by workers, regular preventive maintenance of machine to prevent breakdown. These are my references. Thank you.
Do we have any questions?
What was the visual recovery?
Visual recovery 6/60. Right eye 6/60. Left eye initially 660. It improves.
When the patient has come after the injury?
After 1 month, ma'am.
The time duration of the patient?
Yes, ma'am.
1 month after the injury he came?
No. After
The time duration when the patient come to you?
2 days, ma'am.
2 days.
2 days during Diwali
And
vacation.
steroidal dose is there? How
Yes,
much
ma'am.
the steroidal dose is there?
Yes, ma'am.
Steroid dose, eye drop. Steroid eye drop.
Steroid eye drop was given.
How? What is the dose?
1 drop 8 times we have given, ma'am.
1 drop.
8 times.
Why the patient came 2 days after the injury?
Ma'am, maybe actually that time Diwali vacation was going on.
The time duration is little bit very long. 2 days is very much.
And he was far away from the hospital.
Also in the Bokaro, also there is a electro-steel city. So many
Actually,
patients has come with a thermal burn.
This explosion occurs in Jharsuguda plant.
Yeah, Raurkela is
and
the
we
part
are
of.
at Raurkela IGH.
Yeah, that is the part of a steel city, I think. Raurkela. The time duration is very much important that type of patients. If the patient has come to you 24 hours, 72 hours, we are very conscious about the steroidal use.
Yes.
Very conscious. Sometimes your estimate that the patient have a steroidal, they will recover and they will not recover, depends on your patients.
Yes, ma'am.
and what type of presentation is there. Okay, so steroid in every book and in a practical view also, steroid dose is if you want to give or not give, decide yourself. But the 2 days is, I think, that is the 48 hours, na?
I think it's very sad that even in today's day and date, so many patients don't have access to basic
Your
ophthalmic care.
limbal ischemia is also
Yeah,
there.
yeah.
Limbal ischemia.
And I think
Ischemia is also
probably we need to sensitize general physicians towards being more aggressive about their referrals to an ophthalmologist, because
Yes, ma'am.
I'm sure we have enough connectivity to make sure a patient can reach an ophthalmologist in 24
Yeah,
hours.
strong antibiotic with the ketorolac and everything is a very safe side.
Yes, ma'am.
I think so many cases I have seen I'm in a Bokaro Steel City, and the patient has electro Steel City, electro Vedanta is there,
Yes,
the
ma'am.
thermal mud injuries, so much cases I have seen that. So time duration is always reported. It's a very must. And if you have seen the limbal ischemia, then you have a alarming sign, you know. So I think you are more conscious about the steroidal use. You just switch over the more antibiotic, more stronger antibiotic is there. And also IV is also, you have just put it. Any others sub-additive skin infection is there, you just put it.
Yes.
Yeah.
Thank,
Thank you,
Because
Dr.
this is
Vishal.
my part of practice, I don't know.
thank you.
Okay.
Thank you, Dr.